I don't believe that it helps us as a profession to use esoteric terminology or have different kinds of words for the same thing, or take a word that means something and change it into something else. I don't think that that helps us as a profession.
What's going on, everybody? Welcome back to Beyond Adjustments. Dr. Bobby is back on the show, which means two things. One, it's going to be a good conversation. And two, I'm probably going to throw in a bad dad joke at some point. You've been warned. And I'm excited about this one. We're getting into what's really happening inside Kinetic Spine Rehab right now. We're talking growth. We're talking about the season he's in, and we're talking about what it actually looks like when the vision you had in your head starts becoming real. And this conversation, it's different. This is about movement. It's about patient outcomes, and it's about getting people better, faster, not just doing stuff, but actually getting results. And real quick here, before we jump in, this show is produced by Clear Cut Podcasting. Guys, they handle everything, like from setup to recording to editing, done for you publishing. So if you've been thinking about starting a podcast, but don't want to spend like 14 hours figuring out audio settings, yeah, they've got you covered. All right, let's get into part one. All right, Dr. Bobby, let's just jump right in, man. First of all, welcome back to Beyond Adjustments podcast. So happy you're back, man. Thank you for coming.
Glad to be here.
Yes, sir. Yes, sir. I'm looking forward to kind of getting into the nitty gritty of Kinetic Spine and Rehab, man. I want to see what you got going on over there, see how you got things set up, and maybe get some advice to our up and coming emerging DCs and some advice for those looking for chiropractic care, and maybe talk a little about the future of chiropractic as well. So let's get into this, man. You ready?
Yes, for sure.
Awesome. All right, cool. So let me talk a little about your practice. So I wanna ask you how you describe your current season, because practices do go through ups, downs, lulls, highs, and you learn from those different seasons. And I'm just curious, if you could describe to me the current season that Kinetic Spine and Rehab is in right now.
I think the best description I could give is probably it's in a state of growth.
Yeah.
Basically, so every season has like its highs and lows. And at the end of the year into the beginning of the year is usually one of the lower one of the lower points. But we're actually doing okay. We're noticing, every week we seem to be pretty much having the same, patient numbers or slightly more. And so it's not nearly as bad as it's been in the past, just kind of comparing from my previous location.
Love it. So do you feel like it's this feels more like a settled season, kind of anticipating the growth going into maybe Q2?
Yeah. It's basically kind of indicating that things are kind of heading in the trend of growth, just because we're getting more patients each week. So it's good.
Awesome, man. So when we start our businesses, our practices, our ventures, everything, our projects, we have visions, we have things that we think, okay, this is what it's going to look like. This is what I want it to look like. This is where I want to be, right? Even as kids, right? We're like, okay, when I'm 40, 50, 60, I'm going to have, 49 boats lined up on the marina with 6 mansions, right? So when you opened up Kinetic, I'm sure you had a vision, you had something that you wanted to accomplish, and you wanted a space that was right for your patients, that was inviting. It was a place where people saw healing, etc. So that in mind, is this the version of a practice that you envisioned when you opened up your doors?
basically what I was envisioning with the space is an area where people who are active and even people who are not very active can come and get treatment. Active people can feel familiar with the space just because there's, all kinds of gym equipment that they can use. I can, sometimes, a patient will come in and they'll say, yeah, it hurts whenever I do a 250-pound bench press or something, or it hurts whenever I do a kettlebell swing. Well, I can replicate that here. I can be able to see, okay, well, what is it that we're doing wrong, perhaps? Like, what can we clean up a little bit? How can we modify things to kind of, check to see whether there's too much load involved in the tissues, that, the tissues are getting injured because of load management problems. So being able to do that, but then on the other side is people who aren't very active at all. My goal is to try to get people to be a little bit more active. And I feel like if I can have people come into a place that isn't too intimidating, have them start doing some exercises that aren't too challenging, but getting them familiar and more comfortable with an environment that is more movement based, versus like a desk, that they're sitting at home at all the time or at work at all the time.
Yeah.
That's kind of what I wanted.
Love it. So keeping with that tone of kind of vision and what's the, and not just vision, but more like the tone of your practice, kind of how you set things up, and the season that you're in right now. What's the biggest area of growth? Because you did mention growth. What's the biggest area of growth in the clinic recently? Like, is it clinical care? Is it the patient experience? Is it the operations?
I think the patient care has been relatively consistent. I think that, I haven't really changed too much whenever it came to patient care. The goal has always been on what is it that I would want for my own family member if they went to, a chiropractor or a physical therapy clinic or something. And if I feel like it's not good enough for somebody that I care about, then it's not going to be good enough for somebody that you care about. So I want it to be that. So that's been pretty much a consistent, trend the whole way with regard to patient care.
Yeah. Let me challenge you just a little bit here. So growth
Yeah.
doesn't necessarily also mean kind of bigger, right? Growth can mean different yet better, right? You might have found something different that is giving you better results in patient care, or maybe you realized a modality works for certain types of patients, things like that. Like what's something that you see that is maybe not different but better, or not bigger but better?
I think just the location itself lends itself to that improvement.
Mm,
It's got more natural sunlight. It's in an area that's more densely populated.
mm.
Those kinds of things have helped for sure. And I've kind of restructured some of like our cash like prices, so that it's not just more affordable for the average person, especially these days, but it makes a lot more sense. It's a little bit more enticing. It's not as challenging to sell, so to speak.
Mm.
So those little those changes, I think, have played a big role.
What's something about your practice that you're most proud of?
How quickly we get people better. when others haven't been able to.
Love it. Love it.
Yeah. We get patients all the time who they come in and they've been struggling with some kind of painful condition for months, years. And, they've been to the ortho, they've been to the neuro, they've been to PT, they've been to chiro, they've been to acupuncture, they've been to, everything. They've tried all the medications, they've tried the supplements, they've tried everything, and nothing's been able to help. They've tried being active, they've tried resting, but the problem still keeps coming back. And where we really shine is we're able to figure out why that happens, and I think that, being able to understand pain in a little bit of a different way than the conventional kind of way of thinking, that plays a really big role, because you're able to really kind of tap down into which bucket does most of this kind of fit into. Like whenever you have if you kind of think of it as like a recipe, what's like the dominant like spice, or what's like the dominant flavor of this dish, and then just kind of working back from that, and not having patients rest on the vast majority of conditions that they have, because we'll never know if the patient is actually improving or not if they're resting.
Sure.
You know what I mean? Like
Sure.
if somebody comes in, oh, my knee hurts, and I say, oh, you know what, rest it, let's go ahead and do all this extra stuff, and they start feeling better, I have no idea if it's the extra stuff or it's the rest that's making it better. Most likely it's the rest, but that doesn't mean that it's not going to come back once they start doing the thing again.
Yeah, that makes sense. I remember from the last couple of times you and I chatted, you don't have a regular kind of chiropractic approach when it comes to treating your patients. Why don't you give me a little background, and then we'll kind of it'll leak into this next kind of line of questioning here. Yeah, you're on the hot seat. Sorry. Dad jokes. They're terrible. They're so bad, Dr. Bobby. They're
It's all
so
good.
bad. They're so bad. They're so bad. I'm so lucky
It's
my
all
wife
good.
is still here, man. It's crazy. If you've been enjoying this so far, real quick, do me a favor. Make sure you're subscribed, following, send this to someone who needs to hear it. And just a quick pause here so we can keep the lights on. This episode is sponsored by AI Local Boost. And listen, if you're a business owner, you're going to want to hear this, because Google just rolled out something called Ask Maps, which basically means people don't scroll anymore. They just ask, who's the best chiropractor near me? Who can fix my shoulder before leg day? And AI just gives them an answer. Here's the kicker. That answer is pulled directly from your Google business profile. So if your profile isn't dialed in, if your photos are from 2017, if your services say the stuff we do, you're not just lower on the list, you're not even invited to the party. And that's why AI Local Boost was built. So it helps automate and optimize your profile so you actually show up when these AI searches happen, without you having to log in every day and pretend you know what SEO even means. All right, let's get back into it. So why don't you give me a little background on what that looks like for your practice?
So I'm a big proponent of common language in healthcare. I don't believe that it helps us as a profession to use esoteric terminology or have different kinds of words for the same thing, or take a word that means something and change it into something else. I don't think that helps us as a profession.
Yeah.
I think, when it comes to like the subluxation model, the subluxation model for chiropractic, I don't think that helps us very much, because one, there isn't a lot of evidence to support it. And then two, when we're calling it a subluxation in the medical world, like in healthcare, a subluxation means something completely different. It's an actual thing, that you can see it. You can test for it. You can, there are images that you can show. There are tests and different types of stresses that you can cause that can showcase that this is actually a mild or minor dislocation of a joint. With chiropractic, it seems like, almost anything that you don't like can be, called a subluxation. And so I don't think that kind of mindset or that kind of branding for something that already has a term in healthcare is a good thing for us. Also, I don't think that, whenever we call spinal manipulation an adjustment, I don't think that helps us very much either. Just because there are other professions that use, the same tool. It's spinal manipulation. And whenever, if we can agree that words have power, words carry weight, then when you hear the word adjustment, or like you think of, your spine getting adjusted, what it conjures to the average person is that there's something that is out of, it's out of position, like a book on a bookshelf that isn't quite sitting right. And that it's the chiropractor's job to put it back into alignment. And that just doesn't happen. There isn't any research to support that it does. But that doesn't mean that spinal manipulation isn't a useful tool. It doesn't mean that it doesn't make people feel better. It doesn't mean that it doesn't help people be less fearful of moving if they are in pain. It doesn't mean that it doesn't help reduce discomfort or increase range of motion.
Can I just interject here for a second?
Yeah, go for it.
So I'm your layman, right? I am no doctor, nor did I go to medical school, but I could tell you this. When it comes to chiropractic care, I've experienced kind of 2, maybe 3 different lanes of it. You have the one lane where you're going through this conveyor belt of cracks and pops just so you can, and then it's almost like this placebo effect of you getting better. You have this another kind of chiropractic teams that take it seriously and have care plans and not just manipulate the spine, but have home care and exercises that they give you to do and things like that. They're intentional about it. And then you have the more severe cases, like I think my kids have scoliosis, so I had to experience that side of things where I actually saw things move. Like I actually saw the care, and but that's more intense, right? I mean, they were in these things. They look like electric chairs to me, and like all these different exercises, and they were ridiculous. But I saw, like I physically saw from one X-ray to the next, because of those different things that were happening, their spine shift and go back into place. Heck, my daughter went from a 30-something degree curve down to a 9. I mean, you can't tell me that the manipulation and the contraptions that she was doing didn't do it. It did, obviously. So I'll push back a little bit on the whole chiropractic not shifting, because I think what you mean is that mindset of chiropractic, and correct me if I'm wrong, that chiropractic fixes the body, is not the right mindset. It's chiropractic being used as a tool to get the body back into a place for it to heal itself is really what we should be doing, or the way we should be thinking, is that our bodies are designed to heal themselves. Like they're a although they're not a well-oiled machine, they are a machine that were built in a way where if everything is in line, if your nervous system's working properly, it is designed to fix itself, right? Maybe with some supplements and good diet and things like that. But I believe that, the world we live in, the things that we do and the foods that we eat hurt more than help, right? With all this sugar intake and everything. Um, but that chiropractic can help free up your nervous system, right? In order for it to actually communicate with the rest of your body. That's how I see it. Like, again,
Sure.
layman, I'm not a doctor. Like, I have no idea what I'm talking about here, but this is what I've come across. What do you think?
Sure. So I think that with regard to, things kind of shifting, with care, that's challenging just because there are different types of scoliosis and there are different causes. Going from 39 degrees, which is very severe, to 9 degrees, which is not at all, that's pretty awesome. And
Insane. Yeah.
I'm glad to hear that,
Yeah.
that worked out.
Yeah.
But without not kind of like knowing like the cause or like the type of scoliosis that it was. I mean, like there are people who come in and you'd swear that they are scoliotic because they're standing like this, they're crooked, but they don't have a true structural scoliosis. They have a functional scoliosis. And and that usually is because of like a disc problem or some type of response to pain avoidance in an area.
Yeah.
And that doesn't mean that chiropractic can't help reduce that.
Yeah.
Doing the right things helps the right conditions.
Yeah.
So there is some nuance there. But with regard to being able to kind of like have chiropractic kind of free up like the nervous system and everything like that. I think that there are lots of things that can do similar things. It's really just kind of a matter of what is it that you like? What the research kind of suggests is it doesn't really matter too much if you see this type of chiropractor or that type of chiropractor or this physical therapist or that physical therapist or this acupuncturist or that acupuncturist. Everybody tends to get better roughly on the same timeline. And that really kind of goes to show that one, the majority of people who are seeking care, they're going to get better one way or another. But the other thing is that people like what they like. You know what I'm saying? Like some people are like, that's their bag. Like, they want to do acupuncture. They want to get like the needles and stuff like that. That's their bag. Great. And they think that makes everything better. Fantastic. Some people want to pull like an elastic band and do a whole bunch of like exercises or whatever. Fantastic. As long as it's getting people to not be so afraid of what it is that they're going through and helps them feel better and helps them kind of move a little bit more than they otherwise might have, that really plays a big role in, the nervous system's ability to regulate itself, and
Yeah. No, I agree. Actually, I agree wholeheartedly with that. I think our mind is a very powerful thing too. And
absolutely.
and I think that we believe our mind when we shouldn't sometimes, right? So because it could be controlled by fear at times, right? So I'll give you
Yeah.
a simple example. Has nothing to do with the body, or maybe it does. I was sitting with my daughter yesterday, and she's in chorus this semester in her school. She's in middle school, and she's like, "Dad, I need you to teach me how to sing." And I'm like, "Teach you how to sing? Okay, I can help you. So let's walk through this." So we're going through the song that she's singing, and every time she got to a particular note, she would literally tense up. She would tense up and she would tighten her throat. So I'm like teaching her how to whatever and all these things, techniques. But what was holding her back is not that she couldn't hit the note. What was holding her back is her brain telling her that she couldn't hit the note.
Yeah.
So when we kind of retrain our brain sometimes, right, and we almost force ourselves into the right frame of mind, our body will heal itself better. We won't be standing like
Yeah.
this because we feel like we might hurt our body if we go a little too far. Like I feel like that's a big part of it too, because that's what causes some of the stresses that we have in our body. Maybe. I don't know.
Yeah. Yeah, for sure. There is good evidence that shows that whenever people go into just treatment in general with a positive mental attitude, they get better faster. So being able to, have a more positive outlook on the treatment, the goals of treatment, the time frame, all that kind of stuff. And also just, having like mental toughness. I know that we've all heard about athletes or just even just people in general where the doctors have told them they will never X, Y, or Z again. And
Sure.
sure enough, in a couple years of trying, they're doing it,
Yeah.
So the mind is an incredibly powerful tool.
Yeah.
Absolutely.
Yeah.
So yeah.
I love that. All right, cool. So let's talk a little about your care model. I know we talked about how your practice is it's a little bit different than your average practice or facility, and we kind of touched on what makes it different than a traditional chiropractic setup. You are a DC yourself, so but it doesn't feel like a come in and get adjusted and then leave, right? There's more thought behind it, um, which I love, and I think a lot of people should go into that with that mindset. Now, full transparency, I'm more on the bandwagon of heavier chiropractic, science based stuff than what we're talking about here. But I also believe that the evidence is in the results as well. So, this is kind of shutting me up because it sounds to me like your patients are getting better and they're getting faster results, and so I love that. And I know you're not about the fluff either, which I love, right? You're not like the next shiny new object or modal that I want to bring into the practice so that I can be cool, right? That's not who you
Sure.
are. But
No.
are there any newer kind of modalities, tools, maybe approaches that you actually incorporated recently?
Um, the newest ones, I think, we've been using those for a little bit over a year is they're the class 4 laser
Mm,
and the shockwave.
okay.
Utilizing those to, treat patients has kind of helped with, speeding up
Yeah.
some of the recovery times on
Yeah.
average. They're not covered by insurance, but most patients are happy to pay for it because, I don't pressure them into it. I tell them, you don't have to make any kind of decision right now. Take a brochure, go online,
Yeah.
look into Chat GPT, like do all the research because I want you to feel, comfortable with what it is that you're about to do if you
Sure.
choose to.
Yeah.
And, I think that, that kind of approach, not only does it help build trust with the patient, but it also, gives them agency over their own care. Like they can actually look at stuff and make a decision. I'm a proponent of, people being able to look at, good research and making
Yeah.
decisions for themselves and kind of basing it off of what the majority of the research or what the better quality research can indicate, as opposed to kind of like different posts here and there on like Facebook blogs or like blogs or Facebook pages and stuff like that, where people are being like they're posting stuff that's counter to what the best available evidence can suggest. I think that being able to, for people to be able to have agency over their own care is really, really, really important.
Yeah.
And it's a team approach. I think that when we look at things as a team approach and we realize, look, this is not all just going to be on me to get you better. And it's not going to be completely all on you to get things better. This is a collaboration. This is basically, I'm going to teach you some stuff. I'm going to do some of the things that I need to do to increase the amount of forces into a certain area that isn't getting enough. But I need you to continue on with that. Like, I need you to, at home, do this exercise that reinforces more of what it is that we're trying to do. I need you to make sure that you are, sleeping. I need you to cut out this. I need you to cut out the tobacco products. I need you to start taking this supplement a little bit more. Different types of things that help really get their bodies to hit the reset button on the thing that was bothering them.
Guys, that wraps up part 1 with Dr. Bobby. We talked growth, we talked vision, we talked about what it actually looks like to build a practice that gets real results. And honestly, we're just getting warmed up. If you got value from this, make sure you subscribe, follow, and share it with someone who needs to hear it. And guys, do not miss part 2, because we're getting into leadership, systems, and a few things that might step on toes. In a good way? I don't know. I'll see you in part 2.